everybody, and thank you for your questions. This morning I'd like to discuss the question related to the longevity of implants. How long do implants last? To understand this, there are two types of implants that are commonly in use today. We have saline implants, which are a silicone shell filled with salt water, and we have silicone gel implants, which are filled with something called cohesive gel or silicone gel that tends to bind together. These are also known as the so-called gummy bear implant because they look kind of like a gummy bear candy when you open them up. The silicone implants are used in almost 100% of my patients at present. Saline implants were very popular in North America prior to 2006, when that was all that was available to surgeons except for compassionate use. Silicone was reintroduced into the North American market and the Canadian market in 2006, and since then has slowly become more popular because of their longevity, their durability, their natural feel, and the tendency to show less rippling or wrinkling underneath the skin in women who do not have a lot of breast tissue to cover their breast implants. So in my practice, the majority of my patients tend to choose the silicone gel implants. A saline implant on average will last approximately 10 to 15 years, whereas a silicone gel implant typically will last 20 to 25 years. These are approximate numbers, they're averages that are put out by the implant manufacturers. I've seen implants that last much longer than this, some up to even 40 years, and some implants last much less than this. It's hard to know precisely in each individual patient, but those are averages. So the question, should implants be replaced every 10 years? I would say not at all. If there is no problem with your implants and you're pleased with the results, there's no reason to change them unless a problem develops. So what problem might occur? Eventually the implants, both saline and silicone, will leak or will rupture. And this will happen at an unpredictable time. So it's not like tires on the car where every 4 years you say, probably time to get new tires. You would leave the implants until a problem develops and the implant deflates. In a saline implant, when there is a small break in the silicone rubber outer shell, the salt water, the saline inside the implant will leak out over a fairly short period of time, causing deflation of the implant. You'll see this by a loss of volume in the breast or perhaps increased rippling in the breast, which can be seen or felt. This shows that the implant has leaked, and this is not dangerous in any way to you, but is an indication that it's time to change the implant because it has deflated and you wish to regain the aesthetics of your breast. This operation is typically done under general anesthesia in the operating room and usually has a very quick recovery. When a silicone gel implant ruptures, it's a little more difficult to tell because the gel is made in such a way that it will still hold its shape even if it's ruptured. And there are likely many women in North America and in the world who have ruptured implants in place and are not aware of this. This also is not a dangerous situation. To the best of our knowledge, a ruptured silicone gel implant will not adversely affect your health in any way. It will not increase your risk of breast cancer and should not affect your well-being. However, if the implant is ruptured, I would recommend changing it since the implants were not designed to be inside of your breast in a ruptured state. Usually a ruptured silicone gel implant is determined by breast imaging, either an ultrasound, a mammogram, or most precisely an MRI examination. So if there is a concern that an implant might have ruptured, one of these studies would be appropriate to determine if in fact the implant is ruptured.